let's get to talking about hip and low back pain. Probably one of the biggest conversations that I have on my table on the daily, right? So why is it there? Why is it present? Why isn't it going away? So a lot of times, if you've tried your traditional routes of traditional PT, you've done chiropractic, you've tried acupuncture, you've done, you've been working out, you've been lifting, you've been stretching, doing all that type of stuff. But why is that back pain still just nagging there? Or feeling like when you, let's say, for example, if you're trying to do squats and you get this like weird pinching in the front part of your hip, right? So why is that present? What is going on? And how the heck can I fix it? So let's talk about the anatomy of the pelvis and the girdle itself, because I think that'll help create a good foundation for what it is. And who doesn't, as a PT, I love talking about anatomy because it's what we do. We live, breathe, and talk movement. So let's talk about the anatomy of the pelvis first to kind of get yourself oriented with what is going on. So we've got my lovely pelvis here. I should name her. Drop a comment on what I should name this pelvis. That would be a fun thing to do. And maybe I'll send you like a $5 gift card to Starbucks or something. So name the pelvis first. So, okay, we've got our lovely pelvis here. She sits just like so, right? In the pelvis, it's not just the pelvis that we have to talk about, right? We've got the spine that runs along the back that has and supports your back, right? You've got the abdominals up front, you've got the pelvic floor, and then you've got your hips, right? Hips and your butt, right? So we've got basically four or five different quadrants that we're talking about. And if one of them is off, it can be why back pain or hip pain is present. So if you think about the core as a canister per se, and in that canister, we're working with breath first. So we've got the diaphragm up top, the pelvic floor down below, the back, and then the core, right? So in that, what is happening is if we have an off port, let's say we poke a hole in the, let's see where we're going to poke the hole. Let's poke a hole in the abdomen, right? Let's say we have some ab separation going on or some ab weakness going on, and we poke a hole there. Well, the rest of the canister has to conform and contrite, or conform to make, what is the word contrite? That's not even a word. It has to conform and protect that core that is weak, right? So what's going to happen? The back or the spine is going to compress down because the front is getting lengthened out because it's weak. It's just stretching, right? So what that can look like is, okay, let's say I have a really weak core going on. So what's happening is, I'm going to over-exaggerate this so you can see it, but what's happening is the core is doing this number, right? Because it's weak through here, right? So what's happening to my low back? Watch what happens. So if I got a nice, strong posture and strong core here, the second that core goes and slowly lets go, look at what's happening. I'm getting back tightness. I'm also pushing my hip into my socket more. So when I try to go down for that squat, ouch, that hurts, right? So you're getting that pinch in the front because you're weak in the core. So that could be a reason why that hip and low back pain is coming on for you, is because we've got some weakness in the front that you need to address. Well, Sarah, I've been doing core exercises. I've been doing this. I do crunches on the daily. I'm doing rotations. I'm doing all that stuff. Well, why isn't it getting better? Okay, so then we need to dive into core engagement a little bit more and what that looks like. So a little bit more of an anatomy lesson there is we've got the rectus abdominis, your six-pack abs that run north and south, right? Then you've got the internal and external obliques that help with rotation, help with rib mobility. Then we have, underneath all of that, we've got that transverse abdominis. And if you place a hand on your rib cage and then your pinky finger down on your hip bone, that is where that transverse abdominis is. So the transverse abdominis, when activated, so i.e. when you cough, sneeze, or forcibly exhale your breath, that's the first set of muscles that are going to fire. So what that looks like is when you exhale, those are the muscles that are supposed to fire first. And what that does is it flattens. So if you think about the transverse, it's flattening the abs, right? If the transverse isn't strong, she isn't going to be able to flatten those abs, and that's why that core is still going to feel weak. But Sarah, if the abs are being pulled this way, that's going to make my ab separation worse, right? You are right. That means then we need to work on strengthening of the rectus or your six-pack abs to help mitigate or balance out the pull from the transverse and the weakness of the rectus. So it's kind of chicken and egg, what came first, but really it's about getting that balance between the two of them. So the more we can strengthen here, that's going to, so let's say you've got some lower core weakness, which is forcing that pelvis, again, to shift forward. The second we can get that pelvis to be stronger and come up, look at what that does to my posture. I'll get pelvis out of the way. Look at what that does to my posture. It goes like this, right? So if you place your hands on your hips and you got little pistols here, right? You want those pistols to be pointed straight forward. If your pistols are pointed down, then you know we've got lower core weakness, some back tightness, maybe some hip tightness too, that we want to address. An opposite way is if we're over clenched and our pistols are pointed forward and up, then we know we've got some glute tightness because we're weak and we have to get those muscles to let go. So those that stand a lot, those that sit a lot, you can have some butt tightness that is also causing your back pain because the back is now being overstretched and unable to support. So that's kind of the what and the why behind it. If you have any questions on this, this is my bread and butter. I love to chit chat about it, and I would love to answer any questions that you have. I want to make this short and condensed for you, so please feel free to reach out via DM, shoot a message on here in the comment section of this live. I would be honored to answer it for you, and also post in the comment section what we should name the pelvis, because I feel like she needs a name. It is a female pelvis. I feel like she needs a name, and let's get her named like Perry, or I don't know, Paula, I don't know, Petunia, something fun. Let's name the pelvis, and then the name that I choose will get a $5 gift card to Starbucks or something like that. So have a great Friday. Enjoy this lovely weather and the wonderful weekend, and we will chat soon. Take care.